Tonight, 5 investigates and covers all new allegations of fraud in Minnesota.
And this time, it involves hospice, end-of-life care, paid for with billions of taxpayer dollars every year nationwide. Eric Rasmussen joins us with his months-long investigation into one provider that's now the target of some complaints.
And Kevin Lindsay, we've confirmed these are formal complaints filed with Medicare, the Minnesota Attorney General, and even the FBI. They all focus on a for-profit hospice company in Dayton. Now, to be clear, the owner denies any wrongdoing and blames a former employee, but family members of dying patients tell us they still have questions.
It's just hard because my mom's so vulnerable.
Loved ones left in the dark. A local hospice provider under investigation. Talk about making up vital signs, sending notes to a doctor so that they can bill Medicare. Are those types of allegations things you hear about in this industry?
Oh, yeah, and they're fraud.
Hey, Frank. 5 investigates trying to get answers. Well, I'm here to ask you about the allegations that you're ripping off taxpayers. What is the response?
God bless you, brother.
Franklin Nguyenye categorically denies any wrongdoing, and he has not been charged with a crime. He says his company, Favoured Hospice in Dayton, goes above and beyond what other providers offer.
And it all sounded so good.
This family member of a patient previously under Favoured's care asked not to be identified, fearing retribution.
There was going to be an RN, an aide. They're helping with showers. I think it was 5 times a week that someone was going to be there.
Was there ever a discussion or a question about how all of this is paid for?
Yes.
The answer, Medicare, federal funds available to people over 65 and those with certain disabilities. In this one case, more than $6,000 a month from the feds straight to the hospice provider. Records show near daily visits from Favoured Hospice staff, but that did not match what family members observed.
I thought it was just starting to get odd, that I didn't see anyone with my mom. And to me, hospice takes a special person to be in hospice, and my mom wasn't receiving that type of care.
Now 5 investigates has reviewed formal complaints from former employees that the same thing was happening with other patients as well. One report to the U.S. Department of Health and Human Services describes staff making up vital signs, adding notes to the chart of a patient already discharged, and a majority of patients on Favoured Hospice well over the 6-month mark. Experts tell us that can be a red flag for care that's supposed to only cover people who are dying.
If it can be proven, then they're in serious trouble.
Dr. Joanne Lynn is a longtime hospice doctor and is among several national experts consulted by 5 investigates. They say the way Medicare pays for hospice can create financial incentives to cut corners in an industry where for-profit providers now outnumber charities.
There are very reputable for-profit hospices that worry about their standards and really try to be legitimate in this world. And then there are the ripoffs that basically use hospice as a game to harvest money from Medicare.
I've got us down for Tuesday at 2 p.m. Days after Frank Nguyenye agreed to schedule an interview with us to talk about the allegations against Favoured Hospice, he canceled. So we came to the company's office in Dayton looking for answers. We just wanted to make sure you had a chance to respond, Frank.
I think I
Right, but I told you we needed to talk to you on camera. I'm a TV news reporter.
And I said no.
Well, I'm here to ask you about the allegations that you're ripping off taxpayers. What is the response?
God bless you, brother.
Okay. What about the families who say you weren't providing the service that you promised? Do you think they deserve an answer?
Is this harassing? Is it part of harassing?
I'm not touching you, and I'm just asking you questions. We're not going to block your path, Frank. What about the former employees who are concerned about this? Do you think the public deserves an answer? We're just giving you a chance to respond, Frank.
Thank you.
Since that conversation, Frank Anguene continued to deny the allegations over multiple emails with me. He says the well-being of Favoured's patients remains a priority. Again, Anguene has not been charged with a crime, but he tells me if he is contacted by agencies responsible for oversight, he says he will, quote, fully cooperate.
So what are you hearing from these agencies that are supposed to be investigating these kinds of complaints?
Right, Kevin, a lot of moving parts here, but CMS, the Centers for Medicare and Medicaid, says it just doesn't comment on potential or ongoing investigations. But when it does find fraud, it says it can suspend payments and make referrals for criminal prosecution. You know, we're also asking what role the state can play in all of this, and I can tell you that's something that we're working on right now.
Okay, Eric Rasmussen from 5 Investigates. Thanks, Eric.